All right, let's pull back the curtain on something we all go through, the medical checkup. We're going to treat it like a detective story, uncovering the clues and the techniques that health professionals use to figure out what's really going on inside our bodies. So let's grab our magnifying glass and get started.
You know the drill, right? You answer some questions, they poke and prod a bit, but have you ever wondered what the method is behind it all? Because it's not random, not at all. It is a full-blown systematic investigation. And the number one source of clues? Well, that's you. Now, you might think a diagnosis comes from all those fancy lab tests or the physical exam itself, but check this out. A whopping 70% of a health assessment actually comes from the patient's story. Yep, just the conversation you have. The physical exam, that's about 20%, and all the other tests make up just 10%. So, your testimony isn't just a part of the case, it is the absolute foundation of the entire investigation.
Okay, so to be a good detective, you first have to know what kind of clues you're even looking for. In medicine, pretty much all clues fall into two big categories, signs and symptoms. And believe me, knowing the difference is totally key. So here's the breakdown. A sign is objective evidence. Think of it like a fingerprint at a crime scene. It's something that can be observed, measured, and verified by someone else. You know, a fever, a rash, a blood pressure reading. A symptom, on the other hand, is subjective. It's your personal account of what you feel. Things like pain, or nausea, or feeling tired. It's crucial testimony for sure, but the detective can't actually see it directly. Okay, so you've got the theory down. Let's put your new detective skills to the test with a few quick case files. I'm going to present the evidence and you decide, is it an objective sign or a subjective symptom? Ready to play?
First up is Vanessa. She's lost a significant amount of weight. So, what do you think? Sign or a symptom? That's a sign. The weight loss is a measurable, objective fact you can confirm on a scale. It's hard evidence for our case file.
Okay, next we have Joe. He's reporting abdominal pain. What's your call? Yep, that's a classic symptom. Nobody else can see or measure his pain. The detective has to rely completely on his testimony to even know it exists. Case file number 3. Mr. Ugboka is perspiring heavily. Sign or symptom? That one's a sign. It's a physical clue that the professional can see and feel for themselves. It's purely objective data.
And for our last case, Pedro. A doctor hears diminished breath sounds with a stethoscope. Sign or symptom? That's also a sign. Even though you can't see it with your eyes, it's an objective finding that was detected during the exam. The stethoscope is just the detective's special tool for uncovering that specific clue.
Great work, detectives! So now that we can tell our clues apart, let's move on to the most important part of the whole investigation, the interrogation. When a patient reports a symptom, how do you get the full story? Well, there's a very specific technique for that.
A health interview is not just some casual chat. No, it's a structured process designed to get every last important detail. And to make sure that no stone is left unturned, professionals use this really powerful mnemonic to guide them.
This whole framework is called PQRSTU, and it's basically a series of key questions. P is for what provokes it or palliates it. You know, what makes it better or worse. Q, what's the quality and quantity? What does it feel like and how bad is it? R, what's the region and does it radiate? So where is it and does it spread? S, are there any other associated signs or symptoms that come with it? T stands for timing. When did it start and how often does it pop up? And finally, U, what's the patient's understanding of what might be going on? This whole structured approach turns a vague complaint into a detailed, data-rich story.
Okay, the testimony is in. Now it's time to examine the scene and collect some physical evidence. This is where the health professional uses their own senses as a highly tuned forensic toolkit.
The physical exam is built on 4 core skills, and they're always performed in this specific order. First, you look. Then, you touch. Then you tap. And finally, you listen. Inspection, palpation, percussion, and auscultation.
So inspection, it isn't just a quick glance. It's actually described as concentrated watching. And it starts the very second the professional lays eyes on you. They're observing your posture, your expressions, and they're constantly comparing the left side of your body to the right, always on the lookout for symmetry and, well, anything that seems out of the ordinary.
Next up is palpation, the skill of touch. And different parts of the hand are used for different clues. The fingertips? They're best for fine details like skin texture or any lumps. The back of the hand is best for checking temperature, and the base of the fingers can even be used to detect subtle vibrations. It's a really sensitive way to figure out what's happening just below the surface.
So after touching comes percussion, which is basically tapping. A health professional will tap on your body, usually with their fingers, and they listen very carefully to the sound that echoes back. And that sound? It tells them a ton about the structure underneath, whether it's solid like an organ, or filled with air like a lung, or maybe even filled with fluid.
So what are they actually listening for? Well, tapping over a healthy lung makes this clear, resonant sound. Over the stomach, which is full of air, it's more of a drum-like sound called tympany. But if you tap over a dense organ like the liver, you just get a short, dull thud. Each of these distinct sounds is a critical clue.
And finally, we have auscultation. This is the act of listening, usually with a stethoscope, to the sounds your body produces internally. You know, the rhythm of the heart, the flow of air in the lungs, the gurgles of the abdomen. It's kind of like eavesdropping on the body's inner machinery.
So, we've gathered our clues, we've got the subjective testimony from our PQRSTU interrogation, and we've got the objective evidence from our forensic toolkit. Now, how do we solve the case?
This is where it all comes together. The detective synthesizes everything. That crucial 70% that is your story, combined with the 20% from the physical exam. See, neither piece is really enough on its own, but when you put them together, they create the comprehensive picture you need to solve the puzzle.
There's this quote by Goethe that just sums it up perfectly. We see only what we know. A health professional can gather all these clues because they've been trained on what to look for, what to feel for, and what to listen for. Their knowledge lets them see the patterns and the connections that an untrained person would just completely miss.
So, here's a final thought for you. Now that you know the framework, the signs, the symptoms, those PQRS to U questions, the 4 exam techniques, you're no longer just a passive subject in all this. You're actually an active participant in your own investigation. So next time you're in that room, what clues will you be listening for? Thanks for joining me.